everybody. We are live, and I am here today with Kat. And the cool thing about interviewing Kat, besides she's awesome and she has red hair, is that we've met a few times, right, Kat? Like we've been on John's Carnivore Roundtable together, which is always a good time, and things like that. But we've never just sat down one-on-one. And so I was super excited to get you on and kind of hear your story and just have a little time to get to know you better.
Well, I'm really excited to be here. I've been saying too, I couldn't wait to be able to chat. So I was actually looking forward to today too.
Oh, that's awesome. So I guess I'd like to start out with, because kind of like a lot of people, I think this kind of happens, like we were talking before the show, you're on with these roundtables or you catch like snippets here and there. But if you could kind of give us a synopsis of, your health journey and how you kind of got from, I know you were vegan and now you're carnivore, but that's like as much as I know. So I'd love to get into all the details.
Absolutely. And I'll try not to, be super long-winded, but it is a long story. I'm 50 years old, so it's important to note that I'm no young buck over here anymore. But when I was a child, I ate regular standard American diet. I was always a skinny kid. I joined the military. I was in the military the Army for pretty much my entire adult life. And I was always very healthy. I never had any health, any issues or anything like that. So it always kind of comes as a surprise. I mean, I guess, we kind of chalk a lot of things up to getting old. But as I started, I would say probably in my late 30s, I started having a lot of just minor health issues, like aches and pains, or my hair was thinning, or I'd have skin issues and little things that weren't, overly alarming, things that you just think that are part of aging. And then my daughter, my oldest, decided that she wanted to be a vegetarian. And I had started to put on a little bit of weight, and things were kind of I was just starting to feel, a lot more fatigue and things like that. But again, nothing alarming at the time. My daughter decided she wanted to be a vegetarian. And so this was probably 13 years ago. I decided to become a vegetarian with her as well. My doctors were always like, yes, that's the best way to go. It's absolutely the healthiest way that you could eat. I mean, you're never going to get fat eating some lettuce. Don't worry about it. It's great. It's great, right? And so I became a vegetarian. And then a couple years later, I became a vegan. And then I became a whole food plant-based vegan. But during that time frame, throughout, I got pregnant with my last son very late in life, and everybody blamed everything on that. I started having fibromyalgia really bad, just pain all over my body. They couldn't tell me why I was having it. I was putting on weight, seemingly. I swear to you, I would wake up and the next day I would have put on a couple pounds. I was losing all of my hair. I broke out in a rash of what I still have to this day, petechia all over my body. Never were able to figure out what it was. Rather alarmingly, I had horrible, and it's a TMI thing here, but I was having horrible monthly cycles where I was just literally bleeding to death. And they kept telling me it was because I had my son late in life. I had fibroids in my uterus. I had all of these things, right? And this was the beginning of what became a very horrendous 10 years of my life. They kept telling me I was like severely anemic. I was going through iron infusions. I was having all of these things. Ended up having to have a hysterectomy I was in my late 30s, early 40s at this point, which was rather young to be having a hysterectomy. I had severe adenomyosis, which was like just my uterus was like really hugely enlarged. And again, none of these things I thought had anything to do with anything. Then progress a few years later, then I'm starting horrible migraines, like debilitating migraines that I couldn't get out of bed. I would miss a bunch of work. I started having like these weird pains in my side that felt like there was a golf ball or something sitting underneath my rib cage. My blood pressure had become very, very high. My cholesterol had become very, very high. They told me I had rheumatoid arthritis. Like I said, I had fibromyalgia, or at least that's what they were terming it. I developed horrible IBS and gastrointestinal issues. My ADHD became unmanageable. Like I was flitting all over the place, unable to even do the most simplest things. And it just continued to get worse. It was like one thing piled on top of another. Then they were like, your CRP is really high. You've got an undiagnosed autoimmune disease that's yet to show its face. And this whole time, I'm like severely fatigued. I never want to get up. My depression was getting worse and worse. I had anxiety that was starting to like surface for weird things. I was starting to have panic attacks. They were telling me that it was because of the service. I had dealt with MST, which is military sexual trauma in the military. So they kind of put it on that. And just things like that, they just kept like basically brushing me off. I would go to the doctor constantly. It seemed like I know 2 years ago I went to the hospital and the doctor in the emergency room so many times that I had I had the maximum amount of CAT scans and CTs and things that you could have in a year,
Oh my
X-rays.
gosh.
Trying to figure out what was going on with my body. My kidneys were starting to suffer. I have fatty liver. They told me I was pre-diabetic. I was insulin resistant. And it was starting to get really bad. And it was to the point where my family didn't want to be around me anymore. And it's not to say that they didn't love me or support me, but when you've got somebody that's constantly telling you, I can't go, my back hurts. I mean, I was hospitalized. I was on a walker. I couldn't walk due to unexplained like muscle spasms and stuff. And so basically I was a burden to everybody that was around me, except my mother. My mother was the only one that, really commiserated with me. And, back in July, I ended up going to the doctor. I had been, like I said, this is not a joke. This isn't me trying to find attention or anything. I went to the doctor begging for help. I was getting so overweight. I was 200, and at the last time that I weighed myself, and this was after I had already started the carnivore diet, I was 235 pounds, which a lot of people say isn't really big, but it was much too large for my frame. And my doctor actually told me to put the Cheetos down and to get up off the couch. Literally, and told me that tough love, because obviously I was not being compliant to what they were saying. I went to a nutritionist.
Wait. Weren't you plant-based vegan?
They told me that I was lying, that I was still doing something. I was eating too much of something, too much vegan junk food or whatever. And I kept telling them that I wasn't. And like my husband at the time, he would try and say, let's go to the gym and let's go do this. But when your whole body hurts and you can't even move without hurting, the thought of going to the gym, and you do it because you want to make these people happy, you want to try to feel like you're doing something, but it was so painful and it was just so miserable. And then nothing ever changed. And I was getting to the point where I was literally eating I was counting everything on this app and just nothing. And they kept telling me that I was not being compliant, that I was basically just sitting on the couch, eating bonbons all day and just living the dream. And when I would tell them that I wasn't doing that, they didn't believe me. And I went to the doctor back in July, and it was a different doctor. I got a new doctor.
Okay.
And she said, you're insulin resistant, you're pre-diabetic, your blood pressure is horrible. They tried to put me on medication for anxiety and panic attacks, but I ended up having something called serotonin syndrome. So I couldn't even take the antidepressants and stuff. And so she's like, here's a prescription for Ozempic. Go ahead and take this. And, and first off, I don't know who could afford that in the first place. But number two, I didn't want to do that because you just don't know what it was going to do to you.
Mm-hmm.
And I was already so sick and miserable. And I was just sitting on the couch one day, and it sounds like it's a sad story, but I just started crying. My mom was gone. I had nobody to talk to. I couldn't call and tell my husband one more time that, I'm this fat, horrible, disgusting, whatever, because that's what I felt like.
Mm-hmm.
And my little boy had come out and walked by, and he saw me sitting on the couch crying. And it's just the saddest thing. He brought this blanket, his little whoopee that he has, and he just covered me up with it. And he was like, "It's okay, Mom. It's going to be okay." There is no child should be comforting their parent because their parent is sitting there wanting to die. Because I don't want to say that I was going to go kill myself, but I really didn't want to wake up the next day. And I happened to stumble across, I just searched one more time, insulin resistance on YouTube, and I ran across Dr. Berry's video because I figured, you know what, let me try the one thing that I might be able to do, and that is combat the insulin resistance, because they can't find out whatever's wrong with me, but maybe I can fix this. I'm going to try one more thing. I ran across that video, then I watched another, and there was this girl, Amanda, Carnivore Me, I think it was, and started watching all these videos, and I got up, I forced myself over to Sam's Club, and I tell this as tongue-in-cheek as I can, but this is true. I just started throwing meat into the cart at Sam's Club, and I'm telling you, it felt disgusting.
Yeah, you were vegan for 10 years, you said.
Well, 13 total, because I was a vegetarian prior to that.
So vegetarian and then vegan. So yeah, that had to feel super weird.
Was so gross, and it looked so gross, and it smelled gross. And I brought it all home, and at first I couldn't even cook it without wanting to vomit. And it was a cross between, I was a vegan trying to eat this meat. I was putting meat in my stomach that wasn't used to eating this meat. And everything tasted gross. Everything made me sick. The only thing I could eat at the time was hamburger. I just lived on hamburger. If I put butter in it, I would be sick. I mean, it was the first 2 or 3 weeks were just horrifying. But I stuck to it. Because all I could think of is my little boy, telling me it's going to be okay, Mommy. And just, it wasn't going to be okay. I wasn't okay. I wanted to die. So I don't know. That's my story. The health conditions, there were so many, and I'm sure I'm probably leaving some of them out. I have books of health conditions and doctors telling me that they don't know what's causing it. Like, I still have this petechia all over my body. They don't know what's causing it. They keep telling me it's some systemic issue, but what is it? But, that's kind of what brought me there. It was literally just desperation. Just one day, I just, and everything for me has turned around, and it happened so fast that I joke about it, but I mean, one time I was just sitting and I was just like looking around, and I remember my husband was like, "What are you looking for?" And I'm like, I don't have a headache, and my back isn't hurting me, and I feel okay. It's 7 o'clock at night, and I'm not in bed, and I wondered to myself, how had I been living all of these years living like that, in all of that pain? And it was just so weird, because when I realized that it was gone, I was looking for, I thought it was going to come at me from behind. I don't know. But I just remember thinking, and I think this is the first time that I haven't had some kind of migraine headache or something. I mean, I don't know, it was just astounding.
That's amazing. So that's a lot of things, which is awesome. But it's one question is, you mentioned, I think you said serotonin syndrome. I'm not familiar with that. So they couldn't give you medicine for your anxiety because you had serotonin syndrome. Can you explain a little bit more what that is?
They gave it to me. Okay. I started taking it. And this is a horrifying story for anybody that's been through this. So trigger warning for people. But I started taking it, and so what had happened was and you can laugh at this now because in retrospect I can laugh on it. But I was for no reason whatsoever sitting in the bathroom going number two. I'm sorry, that's just the truth of it. But and I ended up having what I thought I was dying. I felt like I was dying. The physical symptoms were so bad that I literally had this severe panic attack in the bathroom. And 911 was called. And so I get to the hospital and stuff like that, and whatever, they send me to see a psychiatrist or one of the ones, and they give me Lexapro, and they say, this is for your anxiety, this is for your depression, this is going to help you. And I started taking it, and within a couple days I started having horrible racing heart, dizziness, horrible headaches, and it was throwing me into constant panic attacks. But my heart was racing so high that it was really bad. It was very, very scary. And my neighbor took me to the emergency room, and I later found out that it's called serotonin syndrome, and it's actually, some people cannot take SSRIs or those type of what do you call those, reuptake inhibitors, and it causes almost like the thing that they're trying to stop. It causes that like times 10. Instead of trying to figure out what was happening to me, the hospital stripped me of all of my clothes, took all of my possessions, and locked me in a padded room and left me there for hours. And my husband was in Afghanistan, and he was talking to my neighbor, and he's like, my neighbor kept saying, I haven't heard, I dropped her off and we haven't heard from her in hours or whatever. And so he called the hospital and found out that they had locked me in this room. But this is how they handle, this is how they handle somebody that they drugged with a medication that they had a reaction to. It was horrible. So there are people out there that can't take those type of medicines.
Yeah.
And I'm one of them. Apparently.
And I'm not saying that I think anyone should take those medicines or whether they should or whether they shouldn't, but you just mentioned serotonin syndrome. I had never heard of that before.
I hadn't either. It was a first for me. But I will mention to you that since I started Carnivore, I have not had a single solitary panic attack. I haven't had anxiety. I have literally been able, I can go out to the kids' school and be around people. I can shop at Walmart, which is horrifying and as a general rule. Anyways, I can go, and even my husband would have told you that if I would have been in a stressful situation before, it would have been a bad situation. But we were in a couple recently, and even he commented, he's like, I can't believe the difference in you and how you are just on this even keel now that you haven't been on in however many years. And that started with the carnivore diet, because I mean, up until then, it was a crapshoot on whether or not I, lost it that day or not.
Wow, that's amazing. Yeah. And then you were talking about the first time you went and bought meat. So I've always actually really liked meat. I've never been anything near a vegetarian, even in my standard American diet days. If it was steak night, like give me all the ribeye, and then my husband would have to ask me like, well, aren't you making vegetables? Because I would just like, it's ribeye night, baby. And I'd make that steak. But I will tell you, when I was pregnant both times, so I feel you a little bit, because when I was pregnant, both times I got this crazy aversion to chicken. Like if I saw chicken, smelled chicken, raw chicken, cooked chicken, like I was just going to lose it. Like it was bad. So I can just, I have the sensation in my mind. Like I remember feeling that. It wasn't toward all meat though, but yeah. And chicken was something I don't eat much chicken anymore. I do occasionally, but, yeah, it was, I get it, because it grossed me out. I guess it was the pregnant hormones. I don't know, but,
well,
but I can't imagine.
As a child, I know that, of course, I grew up very, very poor. So, my father passed away when I was young. So my mom, she was raising all of us on her own. And so she obviously couldn't afford steaks. That was a never, ever, ever happened growing up. It was always like hamburger and things like that, or the dreaded tuna fish casserole. I remember those things growing
Oh
up, but I
man.
also hated them. So I,
Mhm.
but the I don't know. I mean, I'd spent so much of my adult life not eating meat that I just sometimes forget that I did at one point in my life. But it didn't. It's weird because now when I smell a steak cooking, it smells amazing.
Yeah.
It just smells wonderful. I won't say that I don't miss vegetables though. I sat next to my daughter the other day and we were out eating and I was having some Wendy's hamburger patties and I looked over and she was eating a salad. And I kind of felt this little sadness because I used to love vegetables and I just
Mm.
looked at her salad and I was like, oh, I kind of feel a little bit sad. But then I took a bite of my patty and I was like, oh no, I'm good. I'm happy. This patty tastes
Yeah.
good.
Right. So yeah, David had a similar reaction to me when you said that about the because you stuck to it, man. Yeah, the fact that you were able to stick to carnivore after so long a time as vegan, that's really awesome success right there. You kind of said it, but I'm guessing it was your son that was your why, because that had to be miserable with like you're just like meat, you gross, but like you just powered
It
through.
was it was a combination of my mom and my son.
Mm, okay.
I really my mother was not that old. She was too young to be gone. And I know I say she's my best friend and I'm trying not to focus on that kind of stuff, but she should still be here right now.
Mm,
And it threw me horribly. It literally did because, like I said, it's not that my family didn't love me and didn't support me as best as they could, but I had become such a burden to them that she was the only person, that I felt that I could talk to. So it was a combination of her being gone and me not wanting to leave my baby reeling like I was, but also this child should not be coming out here trying to comfort his mother. That is not his job, and the fact that he was so like understanding and supportive of it, meaning he had been around it too much. He had been around mom having these health issues and these scares and things too many times. You know what I mean? So
mhm.
for him to just be like, okay, let me go get the blanket. Let me go get my blankie. It comforts me. It's going to comfort mom. He should never have to do that. That shouldn't be
Mhm.
his job. And so it's a combination. Yeah, it's my son and it's all of my children, but he's the baby. But he's the one that's home. And just losing my mom, I just don't want to put my kids through that if I can help it. Not
Right.
early from something that I could prevent, if that makes sense.
Right. Yeah, 100%. I feel kind of a similar way about my dad
Mhm.
because he got Alzheimer's. Well, first he got type 2 diabetes and then Alzheimer's. And he'd been on a statin for since about the 80s, right? Because his cholesterol was too high, and heaven forbid, he was never able to lose any weight. And then, because eat less, move more, and all of that. And I didn't know any of this stuff then. And I just watched him get sicker and sicker. And then when he got diagnosed with dementia, it was like a quick slide. And it was actually dementia and then Alzheimer's he was diagnosed with. And I mean, he beat the average to the grave by a lot. Like once that diagnosis happened, it didn't take very long. Um, and I know we can't change the past and we can't beat ourselves up and all of that. I understand that. But like when I went, meat-based keto in February, my mom followed me like 6 weeks later. And she's doing amazing. So it's like I know that if I had known about it then, she would have gotten my dad on it because she got herself on it. And so it just makes me wonder like how different.
Especially with all of the studies. I mean, I was even
Yes.
talking about it last night about that guy who put that whole nursing home on the carnivore diet or the whole assisted living and reversed that dementia and Alzheimer. I mean, most specifically, one of the patients I had saw that, and because my mom also was suffering from, she was starting to not know who my son was, or she kept calling him the grandbaby, and she would like my youngest has epilepsy, and she knows about it, but knew about it, but then she would start yelling at me because I never told her that he had epilepsy. I mean, so I started to notice a very, very fast cognitive decline on with her over the last, I had maybe a year and a half or two. And I know you, like you said, you can't beat yourself up over it, but man, why
Yeah.
couldn't I just have stumbled across Dr. Barry 6 months before? I mean, would that have even been enough? I don't know.
Yeah. Yeah. I mean, yeah. So, I mean, I'm thankful that my mom, she's on the proper human diet. She's doing amazingly well. And I'm happy, at least I have that, and I'm happy for that. I also feel like it was like a little bit late for my kids. I mean, I'm not going to say too late, but it's late for my kids because they're teenagers now and I don't control what they eat. But you mentioned ADHD. Both of my sons have been diagnosed with ADHD. Can you talk about that a little bit? Like how the progression of that went, and like how you noticed the difference between like maybe even like, because you had to have had it your whole life. So like pre-vegan, pre-vegetarian, and then vegetarian, vegan, and then carnivore. Like how did that differ?
Okay, so when I was young, we chalked it up to just being kids, right? My mom always would tell me I talked too much, or I was always in trouble for talking too much, not stay, that kind of stuff. Those things that back then we didn't know, because mind you, again, I'm 50. When I was in the military, it served me very well. People with ADHD and ADD people commonly believe that we can't stay on task ever, or that we can't do, but a lot of things. But places like the military are good for people, especially with the way that my brain handled it because of that very strict schedule. And for me, that I have to have that. I have to have a strict schedule. I mean, I joke about it all the time, but I have to carry books around with me with everything that I do, my notes, journaling, whatever, because I have to be able to have that. It feels safe for me. I noticed when I really started getting bad, they put me on Adderall. And I'm thinking that Adderall is probably what damaged my heart, because I have a supraventricular tachycardia now that I never had before. And I can no longer take any medications at all. So I'll have to put that out there. But I noticed, and I think that my kids could tell you, my husband could tell you, that it was a joke around our house. I would go start something. You see those videos on TikTok and stuff where, oh, my wife, goes to the kitchen, starts this, does that. That's me. I lived that life every single day. And people were always having to, redirect me or whatever. I noticed now in retrospect, looking back at it, that it was getting progressively worse and worse for me, to the point that my family was starting to kind of make fun of me because I would repeat myself a lot, because I would not really comprehend that I had already been talking about this, or I wasn't able to finish anything. I'm a crafter, and I think a lot of ADD people are, and I have 1,001 projects that I've started all over the place, and I'll get like really into it, and then boom, it got the complete desire falls away. And it's almost like a manicness about myself. And I continually got worse over time. And my doctor told me it was because I was getting older. And they say some people learn how to manage it the older you get, and some people, they just struggle more. And for me, it was becoming really bad. I was having a hard time staying on task at work, and I'm a program analyst, so I have to be able to stay on task. I shouldn't say this. I hope nobody from my work, plug your ears if you're listening. I would, start something on the computer, get up and walk away and go do something else. And I had to be away from my computer for because this hasn't happened recently, but in the past, I would be off doing laundry and stuff like that, and meetings were getting ready to start, and I would completely forget that I needed to be there. So I was very much struggling, and it did become kind of a joke in my household about my absent-mindedness or whatever. But I started the Carnivore in July, And I was just able to teach myself how to knit. Like I'm a big crocheter or something like that. My mom tried to teach me how to knit when I was a young kid. I never could. I couldn't stay on task. It was boring to me, whatever. I just taught myself how to knit here just recently.
Right.
I would have never been able to do that ever. Or, I've been able to finish all of these projects that I would have never been able to stay on task and concentrate. That's not to say that I don't have moments. If I'm tired, it gets pretty bad. If it's usually mostly when I'm tired. I know yesterday or the day before I got woke up in the middle of the night and I couldn't get back to sleep because I don't know about you, but since I've become a carnivore, I almost need no sleep at all. And if you wake me up, that's it. I'm done. So if it was 2 hours of sleep, that's what I got.
Yeah.
But I was really, really tired. And one of my coworkers was like, I can tell you're tired because you can't stay on task. And I get very agitated too. I don't know if your sons do that, but I'll
Yes.
get really agitated.
Mhm.
I can't control that. But I do notice, and any of my family would tell you that it has improved immensely. You'll see sometimes I still talk off a little ways or get off topic. I'm sure in lives and stuff, or I'll forget what I'm saying. But if you could have known me, in June or even, before that, you'd have been like, what an amazing change. And it has to be from the carnivore because I don't know. I don't know what it is that vegetables do. I know that they were messing up my bladder really bad, but they do something to your brain too, because the more I ate, the worse I got. So
Mm-hmm. So wait, you just mentioned your bladder. I had bladder issues too. Could we talk about our bladders?
yeah,
What was wrong with your bladder?
so I have something called interstitial cystitis.
That's what I had. Okay, let's talk.
And I went in and had the scope, which I'm sure you had. That was horrifying as well, where they stuck that tube up there, filled your bladder full of water. There was all these red spots in my bladder. They tried to put me on this. It was like they termed it like an antihistamine. But again, I can't take most medications. It was something that I couldn't take. So I was miserable. My bladder hurt all the time. It didn't matter what I did. They're like, don't eat tomatoes. Don't do this. Well, I didn't do that anyways. I mean, I quit doing it. And don't drink. Well, I quit drinking. And so then I started taking Claritin and Pepsid AC on accident one time. I needed, because I don't know, I mentioned probably I had horrible GERD as well. I was taking Protonics, all these different things for my GERD. I guess I forgot to mention that. I have horrible seasonal allergies. I took Claritin and Pepsid AC together one time, and my symptoms got much better. And so I was taking twice a day a Pepsid and a Claritin to treat these painful bladder symptoms. I kept getting bladder infections. I don't know why, for no reason, and don't know what was causing it. They tried to blame it on my hysterectomy. They tried to say that maybe it was because, your bladder falls or whatever when you have a hysterectomy, but I don't know. It's gone away since I went to the carnivore diet. Pretty sure that it was the oxalates. Because I know I had a scan one time and they told me my kidneys had oxalate stones or something in them, but they were small enough that they weren't going to cause a problem.
Okay.
But I could only assume that it was that. Because I don't have any issues. I haven't taken a Claritin. Matter of fact, the only medicine I take right now is propranolol, and that's because I have SVT and high blood pressure, and that treats both of them together. I'm off every medication that I took, and I promise you it was a lot, from muscle relaxers to the bladder medicine. Oh, flavovoxate for my bladder, sometimes the stuff that makes you pee orange.
Just the stuff that makes you pee blue. I can't remember what it's called though.
I think that's the flavovoxate.
Yeah, I have that.
Yeah. I don't take any of it anymore. Just propranolol. And they told me I could probably never get off the propranolol because of my heart. But, holding out hope.
Yeah, you never know. Yeah, so mine started out with chronic bladder infections, like chronic UTIs, like every 3 months, UTI.
And they tell you, don't use soap, don't do this, don't do that. Right. And I'm like, look, I'm over here with a sprayer and I don't know what to tell you. It's not soap. It's not my shampoo. It's not.
Right. Yeah. They tell you all kinds of crazy stuff. Yeah, it was chronic UTIs. I'd have like 4 a year. You know how many antibiotics that is? That's a lot of flipping antibiotics.
Mm-hmm.
And
Been
at
there.
the beginning, it was before, this was before like telehealth and all of that. Like I would go in, like they would test my urine and it was culturing, bacteria every dang time.
Mm-hmm.
And some of those antibiotics, they make you sick. They give you the really strong ones because you're just
Yep.
chronic. And like they think if they just give you a bunch of Cipro and whatever, and like I can never
Which,
do
for the
that.
record, is horrible for you. Don't Google that medicine.
Yeah. So like it was horrible, but like I didn't know anything. Like I knew this is what I knew. Too many antibiotics, it'll just make you resistant to antibiotics. But like when you have this UTI, what else are you supposed to do? Like you've got, I don't know, didn't know what
They
else
don't
to do.
go away.
Right. So here I was. They started up in my 20s. I'm 48 now, so I'm just a couple years behind you, Miss Cat. But so yeah, so it was like for years and years and years. And then pretty soon it was like I had the symptoms of UTI all the time. Like
Yes.
I would be done with the antibiotics and like I would still have it. So I'd go back and they're like, we don't know what to tell you. Like now there's no bacteria there and whatever. So yeah, I ended up at the urologist and yeah,
Same.
they're like, you have interstitial cystitis. And I don't know when you were diagnosed, but when I was diagnosed, some people say Elmiron or Elmiron.
Yeah, they don't give that anymore, but yeah.
But when they gave it to me, they told me, "Oh, this is so safe." Like I remember her telling
your
me,
eyes.
"Yeah, this is one of the safest prescription medicines out there. If you're going to get a side effect, it might be some hair loss, but that's really it." Now, this only works in maybe 2/3 of people, a third of people it doesn't do anything for, but this is really the only medicine we have. So like, that's what I was told. Again, this was maybe in my early 30s when this was happening. And so like, I trusted them. And so I took it and I will say that I did, my symptoms did improve, but I had to take that, I don't know however many times a day it was. And I don't remember now, 3 or 4 times a day. I don't know. And I had to take that medicine that turns your urine blue. And that was for the symptom relief.
Yeah.
And now come to find out Elmiron stuff. Yeah. It like makes people go blind.
Yep. You're lucky you didn't have those side effects. So it was still, it's been several years, and I can tell you that my heart goes out to you because I've been through a lot of pain in my life, but there is nothing worse than having that feeling of,
yes.
Yeah, it's horrible and nonstop. No matter what you do, it's always there.
You can't sleep. You can't, and I was working, I was teaching through all of that, just miserable. And, so, I mean, in a way, yes, I'm, great. I did feel better. Who knows if it was the medicine or what. It definitely, helped. It definitely helped because it made it less, but I would still have these flare-ups. So I stopped. I've never been big on medicine. So I stopped I always say Elmiron, but I've heard other people say Elmiron. So I don't know, but I stopped it because it was like, I just didn't feel good about taking that much medicine just because I've never liked to. But I would have them give me the blue stuff because I'd get these flare-ups like around my period, and that would just those couple of days where I'd have a flare-up, it would kind of it would take care of the symptoms. But since going like keto and carnivore, I haven't had, and I did have a hysterectomy as well for different reasons than you. And we can talk about that later, but for different reasons than you. And so yeah, they said, wait a minute, you've had interstitial cystitis, like be careful because it probably will come back after this hysterectomy. So just be on the lookout for that. And nope, like I haven't had a flare. I used to get flares, because I do still have ovaries, so like I still have I still like ovulate and stuff, but I haven't had a flare. Nothing. No twinging, no nothing.
Mine would be so bad that if I sat wrong or in the wrong kind of chair for too long, like I have different types of cushions all over on all my chairs, because if you sat with too much pressure in a certain area, then guess what? You'd have it. And then I ended up getting, while I was moving to Colorado, I got a bladder infection probably from holding it for too long on the way here. And I just remember I was in the car driving, and I was just like trying to not cry, thinking, oh my God, it's back. I have to go through all of this again. but it went away after I got some antibiotics. It was good, but I was so scared.
Good. Oh yeah, I can imagine, how scary that would be, because yes, it was like I would sit on my heel, like, just to get like the pressure in the right place to try to like, it was, and then
I even went to pelvic therapy. I don't know if they sent you to that too, which was a whole, I'm sure that it works for some people, but it wasn't working for me. But now I know that it wasn't because of what it was because of what I was eating. I think it was the vegetables were just tearing up my bladder.
Yeah, absolutely. And so yeah, like I said, I haven't had any kind of, nothing, none of that. And so it's just been such a relief, because yeah, it would hurt. Sometimes I would almost feel the pain kind of going up up to the kidneys or something.
Yeah,
like
and then down your legs. Did you get it going down your legs too?
No, I never had that, but going up my back to each kidney, like up each, is it the ureters?
I know you talk about those things.
The kidney. And then I was like, oh my gosh, this is, and then yeah, trying to like draw, like be in a car for a long time. And yeah, it was miserable. And so I'm just so grateful that time is over and I'm not having to deal with that anymore. And like I said, I don't credit Carnivore for all of it, but I was still having occasional flare-ups, and yeah, now I have nothing. So
I could only either it just went away on its own, or it miraculously for me went away right about the same time I started Carnivore.
Right.
I mean, for me, I'm gonna say it's Carnivore, but I suppose it could just be that it did. But there's a lot of things that just went away that I had been dealing with for years that the doctors have been telling me that I was cuckoo for Cocoa Puffs over. Yeah. So I mean, the naysayers on my channel and my videos, there's some of them out there that, that tell me that it's not Carnivore, and maybe it's not, but you know what? Sometimes if believing that it is what it takes to make it work for me, then I'm just going to believe it.
Yeah, I'm good with it. So we have some pretty cool comments in here. Some of them are from quite a while ago here, but Alex was saying it's mind-blowing just how backwards the health organizations are and how badly they are corrupted by people with a ton of money and interest in pushing the wrong things.
Yeah, because there's no money in healthy people. There's no money at all.
100%. And then, yes, Rich is saying the medical community does well treating symptoms rather than preventing them. Yeah, they didn't tell me anything about what could make my interstitial cystitis go away. It was just like, we could try to make your symptoms better. And don't worry about this medicine. It's safe. Like, I believed the doctor when she said that to me. And then it was like, somebody said, weren't you on that? And I was like, yeah, I was. Cause there was like this new stuff coming out about the eyes. I'm like, well, I guess I'm just very blessed that I didn't go blind. So there's that. And then there was a couple people commenting about when you were talking about what your mom would feed you or whatever. Tuna fish casserole, got that a lot when I was a kid. I've eaten my fair share of that too. But Gail says, as long as there was enough cheese on it, I liked it.
I don't remember the cheese. I just remember, and I remember getting sick one time and throwing the tuna fish casserole up, and that was traumatic for me. It might have been part of the reason why I would be.
Yeah, that's traumatizing. Then you never want, if you've thrown anything up, you like don't want to eat it again for a long time. No. But no, my mom would definitely make that from time to time. Gail also says the only thing she missed about vegetables is the sugar and the tasty ones, and the butter and cheese I poured over the rest of them. That's when you said you were your daughter was eating a salad. Yeah, and you were a little bit jealous.
Oh, but I missed Brussels sprouts. With cheese would have been really good now. But yeah.
And then David has a question actually for me. So Christy, when your dad was diagnosed with dementia, did they continue with statins all the way to the end? There's so much strong evidence statins affect the brain's cholesterol factory. David, you know what? That's a good question for my mom, because by the time he was in that stage, I wasn't living at home anymore, because this was just like 3 years ago or so. But I can ask her. She's currently in Oklahoma volunteering for some charity. I forget the name of it. I don't remember, but she's packing up stuff to send to people that need it. I don't know. She's volunteering in Oklahoma is where she is. And so, yeah, I'll ask her, because she would know, because by the end, he couldn't obviously manage his own medications. And so she was doing all of that for him. Rich is saying that your journey is amazing, Kat. I agree. I didn't know we had so much in common too with our bladders. That's amazing. Yeah, Susan says, wow, I had consistent bladder infection. I just realized I'm peeing much better now. I used to want to go every 15 minutes. So yeah, Susan, maybe you had cystitis too, because that's what cystitis feels like.
Mm-hmm.
To the point that my urologist was like, oh, you didn't have all those bladder infections because you just had this cystitis the whole time. I'm like, pretty sure I did, because they were culturing the the urine, but whatever. Doctors, I've had a lot of doctors naysay me, like tell me, no. You don't know
Yeah,
what
I've
you
had
don't
a
know what
few,
you feel.
but
You don't know what it is, because this is what it really is. And I'm like,
I chalk it up to their practicing medicine.
right.
That saying, practicing, well, they're practicing because they have no idea a lot of times. And I don't think they know enough about interstitial cystitis, and I can't say it half the time. So I just call it painful bladder. But
Yeah.
I don't think they know enough about it, because I went from people telling me that it would never go away. This is something that you're going to have to deal with, to can you explain to me how it's gone away now?
Right. I haven't
And
asked
I've
anybody
heard
why
the
it's
same
gone away
thing.
now. I remember them giving me a list of foods. Like, here's foods you probably should try to avoid.
And then the low FODMAP,
Mhm,
however, did they
mhm.
try to put you on that too?
No, they didn't. My doctor mentioned that to me when I went in and then got that really high. I'm a lean mass hyperresponder when I got that cholesterol check. And this was before the blood work came back. And she goes, well, that's weird that you would say that like your inflammation is down, because a keto diet is not anti-inflammatory. And I said, really? I'm pretty sure that's exactly what it is. But if a keto diet is not anti-inflammatory, which diet is anti-inflammatory? That's what I asked her. And she said FODMAP.
No, it was not, because I tried it. And you know what? I did the carnivore diet as an elimination diet,
Mm-hmm.
because I did another, after I watched those videos, the more I started reading about it, it's used to treat autism, it's used to treat epilepsy. I'm trying to get my youngest on it. It's
Mm-hmm.
because it's all of these, even ADHD, it's used to treat. And people, there was this book many years ago, because my oldest boy has autism. And when you think about it, I'm like, now maybe there's something in my genetics, I don't know, but my oldest boy has autism, and there was a book back then, many years ago, because he's almost 30, that was
Mm-hmm.
called Special Diets for Special Kids. I don't know if anybody has ever heard of that, but it was basically a high fat, high protein diet to put these children on with autism. And so when I started really, so I jumped into the carnivore diet, like, head first, without knowing what I was doing, and then did the research afterwards. And it's
Mm-hmm.
used as a low inflammation, low eliminate, to get rid of figure out what it is that's making you sick. So I find that even in the medical community on the wacky side that I'm on, knows and has admitted that that's what it's for. So that's very weird that even your doctor was like, oh no, that's not an
It's not
anti-inflammation diet.
anti-inflammatory. I'm like, I mean, I could see where a standard American doctor might say, oh, you're going to have high cholesterol. But to say that it's not inflammatory, like why not anti-inflammatory? I mean, like what, then yes, what you're saying, then why is it used to treat epilepsy then?
And has been since my son was a baby.
Yes, for a long time. So yeah, I don't understand that either. So let's see. Sorry, I had neglected the chat because I was looking at the stars. So I was just going through the chat to see if I could add any more. But I
Well, while
left
you're looking
off.
at that, in medical school, I don't really think they spend much time taking nutrition classes and things like that.
No,
So I just think that they just don't know. They just
yeah.
don't know.
Well, yeah, and then then my LDL came back. So like, I don't think she knows what a lean mass hyperresponder is. But yeah, because she was like, "This is the highest I've ever seen, and you need to take a statin right now," and all this stuff. So
That's what happened when my triglyceride. I don't know if I had mentioned, I probably did, but my triglycerides were in the 800s. They were
ooh,
so high that my blood sample was milky. It was, they
whoa,
couldn't see the other cholesterol to even give me my numbers originally,
okay,
because my triglycerides, because they turn your blood, like if you have too many of them, almost like a milky consistency. At least that's how I understand it. And they tried to put me on a statin too, which, by the way, I tried to take, got severe muscle spasms, couldn't take it. So thank God for that, because I wouldn't want to. But
right.
my doctor also had no idea about any of this cholesterol stuff at all.
So was that happened? That was like your pre-carnivore, like your vegan blood work was like triglycerides through the roof. Have you had blood work since then? And by the way, we rock. So thanks, Lady Fritzader. Yeah, we do rock. Thank you.
Yes, I've had blood work several times. And actually, Dave, I actually went into details because I don't know what I'm doing. It's probably pretty obvious. I'm sharing my journey on YouTube because I know there's other people out there that have no clue what they're doing. And I'm not a doctor, a scientist, and I barely can operate my computer. If you look at my editing of my videos, that is becoming very apparent that I am clueless. But I talked to Dave Sanye, amazing individual, by the way. He is just a wealth of information. And we went through so I had blood tests done a few months ago that my triglycerides were, my cholesterol was barely elevated. My triglycerides were normal. Everything was just barely elevated, but that's because they look at all of it in the wrong way. So then I had another set of labs done, and I had the mass, what is that one called, where the particle testing done?
Oh, like the particle density size? Okay.
And
yeah,
I went through it with Dave because I didn't understand it, and he explained it to the best that he understood it. And he said that or as we started looking at it and explaining it, I'm the good kind. I have the big fluffy cholesterol. And he said that the percentage, and he would be better able to explain it than me. I just don't know. But my percentage was so low that he said like I was ideal. And then there was something else. He said that my VLDL, I think maybe it was in the teens or something. But anyways, my labs were perfect, just amazingly good from July to now. So I'm not a lean mass hyper responder like you are, because I did watch your video where you had talked about that, and I think we talked about it in one of the round tables as well.
Yeah.
But I was very curious to see what my numbers were going to be, and they are great. Now, my doctor doesn't say that. My doctor was like, "Oh, your cholesterol is still high," but it's not. So
no, I don't know if you've seen our new hostess on Linus Lifestyle, Haley. Her tagline after every video is "My cholesterol is fine," and that's how she ends every video. And it's like the best tagline ever because
that's what everybody says in the comments. Oh, your cholesterol must. No, my cholesterol is better than it has been in at least 7 years. I've had high cholesterol for a long time.
So you started talking about before David asked. I just found it. So David's like, ask her about a recent particle count. So it was really
again
good.
With my ADD and stuff, I have a hard time. I have everything written down. I would have to pull it up to be able to give you the numbers because I can't recall them. But they're all great. They're all great.
Yeah, I'm very happy to hear that. So Susan saying my cardiologist was having a fit because my LDL was 117. He'd have a heart attack with an LMHR. Yes. My LDL cholesterol just says greater than 350. Like the test doesn't tell you. I mean, you could go figure out the math. I think it was even over 4. I forget what it was now exactly too. But yeah, it just says greater than 350 because it doesn't tell you an exact number. But like you could go take the total cholesterol, subtract your triglycerides and subtract your HDL and kind of figure it out, I guess. And I did that, but I forget what it was. But yeah, for sure. Mine's like quadruple that, Susan. So yep, it would, he probably would have a heart attack. And then, oh gosh, okay. So I had to put this up because as people say, so Lady Fritzader, I have yet to experience picanha. It's in my
love it.
Waiting for the right moment. And then I'll let you talk about picanha in a minute, Kat, if you've tried it. But Ellie says, Lady, it's not a Christy live stream without mentioning picanha. So there we have it. I have said my obligatory and contractually obligated picanha for the evening. But Kat, have you tried picanha yet, or what kind of meat are you into?
I was eating it even before I saw so I was laughing because we both were talking about picanha one time at the same time. I had found it in Texas. Our Walmart carried it.
Yeah, my Walmart carries it too. Yeah.
I can't find it here in Colorado. I'm gonna have to go to like a butcher or something like that. Sorry, my train of thought went away. I looked at the comments and got sidetracked, but I'm gonna have to go to a butcher to get it. I did find a couple local. So you probably wouldn't believe this, or maybe you know this, but I didn't. Coming from Texas, I always just assumed Texas is the big, you know, beef state, right? It's all longhorn cattle or whatever. Well, no, Colorado is literally cow farm after cow. I mean, there are farms everywhere out here.
Right.
And there's so many of them right here in the town that I'm in that I actually found several that sell picanha. So, but I discovered it in Texas. Somebody told me it was a poor man's prime rib. So I'm like, well, I'm a poor man, so I'm gonna go find it. And sure enough, and I cooked it. For me, I did it long and slow, right? But some people cook it at like a prime rib almost. But oh my God, that fat cap and that. I just can't. I mean, I literally could wax and wane over how wonderful, amazing picanha was. It just tasted. It was like a ribeye steak and a prime rib got together and got married, and it was just the best. But I can't find it here. It's very sad. But,
that is very sad. Yes, picanha. Yeah, I'm not sponsored by the picanha industry, but yeah, it's like a little joke now. If I don't say picanha once in a live stream, I get flack.
It's so good. It's so fatty and delicious.
So good. And it's not expensive. Here it's like $8.79 a pound or something regular. That's like regular price. Yeah, I really want to do picanha on the smoker. Let me know if you've done that. I don't have a smoker yet, but I just do mine in the oven. It turns out great every time. So
I'd be curious to know. I do have a smoker that I barely know how to operate. I would like to try it though. One of these days I'm going to do some ribs or something out there, but
well, let us know when you do. Make a video. Then I can figure out by your I make videos of myself cooking so people can figure out how not to do it. So when you do your smoker video, I will probably learn.
Yeah,
I'll fumble around with it and whatever. Then I'll
my videos of cooking are all experimental. This is what I did and how it turned out. So.
Seriously, that's my video.
I can't find it at my Costco either, Ellie. I tried. I even asked. They were like, looked at me with this blank stare. I'm like, picanha. It's called something else. I can't remember what it was.
It's called sirloin cap, and then it has a couple other names too that I never can remember for some reason. Yeah, Mike's making a joke about when they culture him. So cultured, they cultured my my urine to find all the little critters in there. Everyone's chiming in with their bladder stories. I love it. My bladder issues must have been from oxalates because I know when I'm dumping oxalates because of the extra fun I have 10 times a day.
Yeah, if that's your idea of fun.
Yeah, well, that's why it's in air quotes there. But so yeah, teachers, we are infamous for our UTIs because we can't just go to the bathroom. Like if we have to pee, we have to hold it because you can't just leave a classroom of 30 children.
Oh yeah, no, I wouldn't think so.
Yeah, so it's like an inside joke in the teacher, community or whatever you want to say that, yeah, we're like the queens of the UTIs because you can't just go to the bathroom when you want. You're trapped.
Well, I didn't even have to hold it to be getting UTIs, though.
Right.
I know that I'm pretty sure that's what caused it on my move, but I would have it just because it was Tuesday, the second Tuesday of the month of January. I mean, it would just be so random for no reason. I would just get them.
Mm-hmm. Yeah, they would come. Yeah, I would just get them. If it had been like 3 months on the calendar and I hadn't gotten one yet, I could pretty much know it was coming shortly because it was really just cyclical. Susan says, I did have cystitis, but thought it couldn't be continual after several courses of antibiotics. I did take oil of oregano. I never heard of oil of oregano for that. That's not something I tried.
Me either. I've heard of a lot of different treatments, though. I know that there was a lot of discussion about whether or not it was what they called an embedded infection, where there was some doctors that were treating it with like year-long courses of antibiotics.
Yes, you're right. I forgot about that. Yes, I was on that. I was on I've blocked that
for a long time.
Yes, a low-dose antibiotic for like a long flipping time. Because they said
you had in it what they called the embedded. Yeah, they were. I was on the verge of that. the doctor, was he in Louisiana or somewhere? I was getting ready to set up to see this one doctor, famous for this, like he's all over, to do it. And then I'm not even sure what happened, but I ended up not being able to go or something. And thank goodness, because that low dose of antibiotic for a year, 2 years or whatever, that can't possibly be good for your system.
Yeah. 100%. Yeah, no, it can't. But when all this was happening to me, I just completely trusted and did what they said. I didn't do a lot of research. Because I just wanted to feel better, and, I thought that was the right thing to be doing. So Dustin's bringing up a point here. We get so angry at doctors, but they're just responding with the training they got from medical school. Most have zero time to keep up on new studies or papers. I mean, yeah.
It's true. I mean, he's not wrong.
Yeah, but it's I guess sometimes what's frustrating for me, so this is another story that's off the diet topic, but I had a hernia. It was, I forget what they're called, but the ones in your stomach. So hiatal, just above the belly button. I knew it was a hernia. A little bubble popped out. I went to my doctor and she told me that I probably just needed to take some antacids because I told her it was painful. And she said if it's a hernia, it shouldn't be painful. So therefore, you must just have some indigestion.
Of course. It's always indigestion, in case you haven't noticed.
Yeah. So that was not very fun. I'm like, if it's indigestion, what's this little bump? And it was a very small little bump, but it was there. It was a bump. I could see it. So that wasn't very fun. But as far as the dietary stuff goes, Dustin, yes, I agree with you. I don't think they're trained, but they sure talk like they know, right?
Yeah. And then when you go there with your not just anecdotal evidence, but also, look, my cholesterol was this. I'm eating only meat, and now it's this. Will you at least give some credence to what is happening here? Instead of telling me, you're stupid, this is whatever, don't do this isn't good for you. I'm putting this in your records right here that I'm saying don't do this, to cover their butts later on or whatever. Yeah. When you come with this evidence, give it some thought. At this point, you don't have time to do all these things, but when you get into your practice and you're not in medical school anymore and you have a patient that's bringing you this, does it not trigger something in you to say, let me just do a little bit more research, or let me concede that maybe this does work for some people? Maybe it does. Instead of doing what my doctor said, I don't agree with this, I'm going to annotate this in your chart that you are doing this against my wishes, and blah 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 blah. Your kidneys are going to fail. Your fatty liver is going to get worse. And for the record, my kidneys are back to normal. And I don't know about my fatty liver because I haven't had a scan done. But they're telling me all of this is that this is all going to get worse. Then explain to me, with your educated doctorese, why my cholesterol did this. Why did my cholesterol dump like this? That fast? And I lose 47 pounds in 4 months. Why?
I wish that my doctor had their first carnivore patient be someone like you, Kat, because unfortunately she's not been trained. Like, to Dustin's point, she hasn't been trained in any of this. She doesn't know. And of course and I'm the first carnivore she's ever met. You could tell by her reaction. She said she's had a couple people go keto and their cholesterol just went really high. And so she doesn't think it's healthy. She also doesn't think it's anti-inflammatory. So those were her remarks, but she did say, but I think different things can work for different people. Well, then here I am, the lean mass hyper responder. And I'm like, dang it. Like, if I could have been one of those people where their cholesterol's like just totally awesome, like what you said, all your stuff got better. Like she did see that I'd lost 20 pounds, but other than that, in her, because she's living in that paradigm, right? So in her opinion, I'm going to have a heart attack any second. And it's just like such a bummer because I wish that a person with different, results could have been her first, because she wasn't totally closed off to it. But because although she was kind of against it, but she was like, hey, this might work for you. Like, she said that if this works for you, great. She goes, I think I'm going to have to call you and tell you, you need to stop it. But we'll wait we'll wait for the blood work. So it was like she was open-minded, and then unfortunately, you know, I'm a lean mass hyperresponder, which how rare is that? Like it's pretty rare. So it's a bummer. Like I'm kind of bummed out because I feel like she might have been one of those that might have changed her mind. And I think because the couple of keto patients that she had, their cholesterol went up, and in her mind, that's bad, right? And then she has me. So I'm like even worse than, you know, I'm even more extreme than keto, and my blood work is even more extreme. Now I think it's solidified in her mind, unfortunately.
Well, you know, and I'm not a doctor, but I think that what affected my cholesterol was the carbs. Because as a vegan, I did eat potatoes and rice. And so it wasn't, as far as I know, the lettuce that was causing it. I think that it was the carbs. And the problem with keto, if I understand it correctly, is they do have carbs, right? They do have some carbs. And for me, just eating potatoes and rice, and it wasn't even every meal, was causing my cholesterol to shoot through the roof. So it's possible that those people that were doing the keto diet may be people that are really sensitive to, because the carbs turn to what? Sugar in your body, which then affects your triglycerides and et cetera, et cetera. So it makes me wonder if they would have been more of like a strict keto, or maybe even more, what do they call that, ketovore or whatever, where it was a little less carbs, then maybe their numbers would have been, I mean, it's a woulda, coulda, shoulda, because what difference would it make? She still would be saying the same thing to you, but
Right. Yeah. Has anyone else? So I saw this is something I've been wanting. Well, I know Dustin has. So Dustin, chime in. I'm not sure. I don't think you'll be trying any more this month, but now I lost it. Anyway, the salty electrolytes. Has anyone else tried that? The salty by Keto?
I saw somebody post about that. I haven't.
I think I missed it. Anyway, it was Lady Fritzader, I think, who said it, and she said she tried the chocolate and then she'd try more flavors tomorrow. I still like both Element and Red.
I'm an Element. I mean, I don't take electrolytes that often anymore, but I did get that chocolate pack from Element that has like the chai, which oh my god. But I'm an Element. I got used to them.
Yeah.
If I'm gonna, I've actually never been experienced or had anybody else's. I know Redmond's has one that I haven't tried, but I'm such a boring creature of habit. I get something, I like it, it works for me, and then I just stick to it. I'm so boring over here.
So here's the thing. I like Element because I do like the chocolate salt. I do drink coffee. I do put the chocolate salt in my coffee, and it is really good. In fact, I'm even getting, like, especially now, I'm trying to like narrow my eating window back down. So I've taken.
Did you get their new one, or the holiday one that has the chocolate chai, the chocolate raspberry, which you could make that one with chocolate and raspberry, and then the chocolate, there's a chocolate caramel. And then there's another one. So the chocolate caramel they're on all the time. The chocolate chai, chocolate raspberry, and something else. I can't remember what it was. Oh, chocolate mint is in their chocolate medley box.
Mint. That's what I wanted to try. But you know what steered me off of that was I knew I wouldn't like the chocolate chai, or I didn't think I would.
Oh, I love it. It tastes so good.
I was like, yeah.
It tastes good. It's like a chocolate cinnamon. I don't know. I like chai, so
yeah. I've never been a big chai person, so I stuck to I did, because you can buy the chocolate caramel separately. Here's the thing.
You can now, yeah.
So because I didn't get paid in December, in my school district, we don't get paid in December. In case anyone hadn't heard, I went that whole month without a paycheck. Yeah. So I was stretching and like not buying any more electrolytes until January, but I have like the Element, like the auto ship thing or whatever, but I just delayed it until January. But I put in like 2 boxes of chocolate and 2 boxes of chocolate caramel, and I had that set. And then Keto Chow came up with salty, but it was like, I forgot to turn off. And then my Element came, and so I have 4 boxes of Element. So it's like, I do want to try the salty from Keto Chow just because I'm down to try it. But yeah, now I have my 4 boxes of chocolate Element. I don't even put a whole pack in my coffee, so it's going to take me so long to get through it. So now it's going to be even longer till I get to try.
And I only added, I unfortunately fell off the wagon in a serious way over Christmas, which was a whole other story, because I'm an emotional eater. I'm an emotion, and I'm on the constant binge strict, which is how I lived my life prior to this. And after everybody left over Christmas, I got really depressed, and I ate half a pie that was left here. I'm ashamed to say, but anyways, I don't really have electrolytes anymore. But now, since I had fallen off, because then once I fell off, I was like, well, heck, I'm off. I might as well just, throw that wagon in the river. But I had to get back on, and so I've been doing electrolytes again, and I got the chocolate melody one, medley, however you say it. And, oh, it's so good.
Well, that's so funny because so what happened was I went accidentally carnivore, and then that's when I started needing the electrolytes. So I had been on carnivore for a month or two, and I started noticing like a headache, and then I started noticing, leg cramps at night.
Yeah.
And I will still, now I haven't stopped recently. I haven't stopped electrolytes recently just to see what happened. But if you can make them, I know you can make them, you guys. I know that. You don't.
I know I can.
Because people will say, you can make them for cheap every time I say how expensive they are. I'm just lazy. But yeah, they're expensive, but I'm lazy. So I'm just going to keep buying them. So for a while, it's expensive. So I stopped, but yeah, then the little headache started to kind of come back. So I was like, all right, I guess my body still, needs these extra things in there. So, but there's other people like Ellie, when she went carnivore, then that's when she stopped needing electrolytes. So super interesting. How
everybody's so different.
Everybody's so different. Gail, you never have to be sorry to Picanha. It's good. It's all good. You started a whole thing in chat, and I love it, Gail. So you just do it.
I think I see it in everything that you're in, though, Christy. Literally, I think every time I see you, there is the word Picanha is in there.
I know. It's because if I don't say it, somebody notices that I didn't say it, like Gail tonight, and they say it, and then it just goes.
It's now your tagline.
Yeah, it is. I can't get away from it. So I recently got memberships on my channel. Not that I have any members, but like my third tier is called the Picanha Pals, because I'm like, I have to put that.
Of course, yeah. That's you need a shirt or something. It's gonna have to be your.
I do. I need a Picanha Pals shirt. Yes, 100%. Okay, sorry, I'm not going to go back on that one. But
okay, yeah, we will.
It was cute that she said that. Okay. So, Lady Fritzader, does anyone know anything more about this? Because I know when you say about to reveal, is there a video drop? Like, do we have a date? So it says, as she says, Dave Feldman and Nick Norwitz are just about to reveal some more evidence about the high LDL not being the problem they have said. So I know that there was more coming out, but like, if anyone has dates, that would be great. And then to that point, David saying, don't be surprised if your LDL soars once you lean out. I heard this too. I've talked to Dr. Norwitz about this, and he says it happens. People becoming lean mass hyperresponders, like once they get very lean, it's not that uncommon. So yes, I heard him say that too, where people can, like, once they finish, if they've lost like all the weight they have to lose, then they can become a lean mass hyperresponder because their body switches to that type of metabolism.
Well, I have probably still 60 some odd pounds I need to lose before I think I'll ever even be there, because I'm still overweight.
So Susan is saying my PCP loves keto and intermittent fasting. He told me to keep doing carnivore as he thinks my numbers are fantastic. So yeah, that's awesome. So yeah, speaking of weight, like I don't know if you said like how, because I know you lost some weight, right? So how much weight did you lose?
47 pounds total.
Okay. Yeah,
that's awesome. Started. So the first 2 weeks that I was doing this, I mean, I was probably literally water weight and just sick. I mean, I'm pretty sure that I had diarrhea so bad it was horrible. But who knows how much I was when I started? Because I can tell you, I was in the bathroom nonstop. If I didn't, peeing, the other, I was constant. I know it was a lot of water, so I'm pretty sure when the first time I stepped on the scale, I was 235, and I had already been doing it for a couple weeks. So, but total now, when I weighed myself this morning, I'm down 47 pounds total. So
that's awesome.
But I haven't lost any, like I haven't been, for a while there, it was just constant, steady down. I haven't lost anything recently, but my clothes, like all of my clothes, are just starting to just hang on me now, and I'm losing girth, size, mass, whatever, but maybe not like my pants. I went from the one time the pants were 36s and they're 31s, and I'm in 29s now. So they're moving down slowly, but
Yeah,
mind you, they're snug. I gotta suck it in, but I can get in them. So
we all know about sucking it in, and whew.
there's like some stuff that hangs
Put on
on
those
the
belt
top,
loops;
but
they'll go up.
I'm like tucking in my stomach roll, and it's okay though.
Okay, I'll talk about that more in a minute. But thank you. Look at Gail is my first channel member. Thanks, Gail.
Oh, yeah.
So I set it up a while ago, so now I have to go look and see what I get to do for Gail because I forgot what I said.
I haven't even set them up yet. I haven't done.
I finally did it. I just did it. Figure I'll just jump in. I'll figure it out as I go. It's okay, Gail, and I do apologize. Here's the thing with channel memberships. If you don't know, you guys, once you set them up, like once you set your prices, those are your prices. And the only way to change the prices is to like delete all your members and start from scratch. So I was like, well, I guess I kind of got to set my prices accordingly because these are going to be what they are. Like, I'm never going to just like boot all of my members.
You should make one of the incentives a T-shirt that says Picanha Pals, and you should
seriously. So first, I'm going to design the T-shirt, and then maybe I'll put that like if they join the Picanha Pals. But it would have to be because it's only I forget what it is, $3.99 or $4.99. I forget what I said. Per month or whatever for that.
It's reoccurring, right? So it's every month.
It's recurring, yeah. So like after they were a Picanha Pal for so many months, they could get a T-shirt that says Picanha Pals. That would be fun. Anyways, thank you.
I'll have to set it up, but I don't have that big of a following yet. So, and again, I say this all the time, but it always blows my mind that anybody even is interested in anything I have to say. So I have a very small channel, but it's still like every day I'm just like, wow, that many people are actually listening to something that little old me, not little old me, but you know what I mean?
Well, I feel that, I mean, your channel's like twice the size of mine, so you're doing awesome. You're doing awesome. So Robin says, congrats on your weight loss. So yes, congrats on your weight loss. So yeah, I started doing something new the other day. You guys, tomorrow is leg day for me. So yeah, I interviewed Coach Bronson. Don't do it, Kat, because if you do, something's gonna happen. He convinced me actually to be more intentional with like the way that I work out. And he explained it in a way that I felt like I could do it. Like it would be doable for me. To actually get some heavy things and lift them.
It's funny that you say that because I actually have enough energy that me and my daughter are actually starting to go to. We're only going to go one day a week to the gym, because I mean my back is so bad and stuff. But it's funny because we're actually going to start this Wednesday. I haven't been able to go to a gym or do anything, and I mean I'm excited. I hope I don't hurt myself, but we're going to try it. I haven't interviewed anybody. We're just going to try it.
So I've been doing like fitness challenges since September, right? I've been doing stuff, but so the reason I've been, and I mean, it's great. And I still love sprinting and I'm still incorporating sprinting. I'm still doing other stuff. I don't know if Carrie's still in here, where we are going to do some resistance bands and some jump rope stuff next month. I still enjoy a good fitness challenge, but it was just like, okay, this month I'm doing push-ups or whatever. And it's because I get bored. Like so I don't have ADHD, but maybe you, my ADHD friend, can relate. Like I can't just sit there for an hour or whatever. Like I'm going to lift these weights for an hour. Like, I can't do it. It's like, no, I can't just be doing that for that long. I just don't have that in me to just do it. And the other thing I was guilty of is, okay, I really got to work out. So then I would just go hard. Like I would go hard every day. And then I would just burn out and quit. So generally that's kind of what I would do. Just like without any guidance, right? Just this is what I'm going to do. But after talking to Coach Bronson and specifically people like, perimenopause, going into menopause, which I am, he's talking about how just vitally important it is. And he said that, and especially for women of like our age group, super important also to rest. Well, that piqued my interest right away. Cause I was like, oh wait, like if I'm working out, I don't have to do it like 6 or 7 days a week. Like I can rest. Okay. Tell me more, Coach Bronson. So basically what I'm doing is, and I'm just going to keep it consistent so I don't forget. So I started on Saturday. So Saturday was leg day, and he said, focus on 3 things: do squats, do lunges, and do deadlifts. I'm like, okay, that's 3 things. I could do 3 things and not get bored, right? So that's all I did. I'm not going to get sidetracked with like leg lifts and whatever, like nothing else. He said, just do squats, lunges, and deadlifts. I'm like, okay. So that's leg day. So I will do that. I did that on Saturday. Then the next day I did, yes, if you haven't seen my interview with him, he dropped so many knowledge bombs. He even gave like a preview to his new book. Like it was really good. But anyways, he is great. And he was very like friendly with the advice and just like gave all the advice. Anyways, and the Sunday I did upper body. Now I didn't ask for advice on upper body. That was my fault. But I kind of did a little, obviously it's going to be biceps, triceps, back, shoulders, whatever. So I just kind of found some compound movements. I'm vlogging about it, but I tried to do the same thing where I think I got it down to like 4 exercises. And then I did some jump ropes on that day. And then today was my day off. Like I took a rest day. And then here's what he said. So he said, just like for an example. So when I did my squats on Saturday, I did 3 sets of 10 squats and I had 9 pounds in each hand when I did them. So assuming that was enough work and I rested, technically I rested my thighs, butt, and legs for 2 days because I did upper body the next day and then today was a rest day. So now my body's had 2 days to go, oh, that's what you need me to do? Okay. And then that's when it like kind of ramps it up. So we will see tomorrow. What I should be able to do tomorrow is either increase the reps, so like keep the 9 pounds, but maybe do 11 reps instead of 10, or increase the weight, even if it's just by a pound. And if you can do that, then you did it right. If you can't do that, then you either didn't work hard enough when you were working or you didn't rest enough. And I was like, well, that's simple. Like I could understand that, right? So it's going to be like basically lower body, upper body rest. That was today. Then tomorrow will be leg day again. And then Wednesday will be upper body again. And then it'll be Thursday rest. And then on Friday is probably when I'll do like a little bit of core or something like that. I don't want to get off, right? So then, and then Saturday we'll go back to leg day. Cause basically he was telling me I could do legs twice a week, upper body twice a week, and then rest. So I'm like, okay, that I can handle. It doesn't seem overwhelming. He gave me 3 exercises. So I'm not like for an hour, like I can do that. I can put on a YouTube video and just like, and then you're lifting real, as heavy as you kind of can. So it's not a ton of reps, and so I'm starting it. I'm being like diligent. He told a lot about protein and fat. Buy less junk, more health. Thanks for popping in. He talked about why ratios are, your body doesn't understand ratios. And so he talked about 1 to 1 to 1, talking about like, it's 1 to 1 fat and protein with whatever your lean body mass is. Unless you're too close, he said, ladies, unless you're too close to 100 pounds, like you don't want to go under 100 grams. So I'm trying to hit like 115 grams of protein and fat. So I am tracking, but only the protein and fat. Like I don't care about calories. I don't care about that, but just so I can make just because I've never tracked just those before. It's a lot to eat, you guys. Oh my gosh. I had that live I did at 4 today and I had to like shovel in 3 burger patties, some bacon, and like a tablespoon of butter. And I had like 20 minutes to like, cause I had to cook it and then I had to shovel it in my face so I could be live at 4. But I hit those macros. So we'll see. I mean, I'm brand new, right? I took some pictures. I took some measurements. And I'm going to vlog about it and post like once a week. I don't want to inundate people with every day. So yeah, just like that. Yeah. So we'll see how it goes. If anyone wants to join me, that's what I'm doing. It's like pretty easy. And I feel like it's doable. Like it's not going to overwhelm me. It's not going to get cause I get rest days in there and those are actually important. So today I was able to say, today's a rest day and like my body needs this. This is actually good. This is where my muscles are actually doing their growth instead of like, you're resting, you lazy slob. You should be working out. Why are you being lazy? Like that used to be the self-talk if I had been working out, but I took a day off. So we'll see. But that's awesome. Going to the gym once a week with your daughter. That's great.
Yeah.
Yeah. Have you gone yet, or have you just like signed up and you're getting ready to go? Have you done it?
Well, not really. I mean, back before I started Carnivore, my husband used to try to get me to go to the gym quite a bit. He likes to go to the gym. Does that a lot. It's just too hard for me. I think maybe once or twice back when I was still in Texas, I went and walked on a treadmill, but I just haven't done anything since. With the move and all of the things, the holidays and all the things that have been going on for me, I just, I'm guilty of being lazy and just not making the time, because certainly I have time. I just tell myself I don't have time.
Mm-hmm.
And then, for a while there, everything hurt and I just didn't want to do that. And I didn't want to compound. And then to be honest, in the beginning, I couldn't get 10 feet away from my bathroom, so we certainly weren't going to go anywhere then. But I just kept making excuses. It was just a lot of excuses. I don't have enough time today or whatever. But I'm going to make time. It's really cold here right now. I would rather walk outside, but I want to. My daughter wants to lift heavy things, is what she calls it. She's like, I want to go lift some heavy things. So I think that's what I'm going to do. I'm just going to kind of follow suit. I don't typically lift weights though, no, because with my back and my arthritis and stuff like that, I don't know if you try to do that kind of stuff when your joints and everything hurt. I couldn't even lift my elbows. So we're going to see. We're going to see. I'm hoping that it's not horrifying and that I will stick to it. But I'm not known to stick to things, quite honestly. So
yeah, well, I'm looking forward to, I'm sure we'll catch each other like on a Carnivore roundtable sometime. And yeah, I'm looking forward to, an update on that. Gail is saying she wants to exercise too. Well, I want to exercise too.
I want to. I'm just always make excuses why I can't.
Yeah. Susan saying, I've been doing leg exercises from a YouTube site called Grow Young Fitness. All the exercises are sitting on a chair. I also did some of my old ballet bar warm-up exercises. I remember those. I was in ballet for like 2 years as a kid, as a little girl. Yes, Susan, 120 grams today and I'm stuffed. Yes, and I ate like a bigger lunch. Oh my gosh. Okay. You guys, don't be too shocked. Everybody in the chat, are you ready? You're never going to believe what I ate for part of my lunch today. It was not picanha. It was a can of salmon, you guys. If anyone knows me, I hate seafood. I hate it.
Is that unusual?
I hate it. I hate it so much. I ate a can of salmon because I needed to get more in. So like I had my 2 eggs, had a can of salmon, and I had like a cup and a half of bone broth. The thing about tracking is I have no idea what the macros are on my bone broth because I make it. So that's the thing about tracking that's tricky. I'm like, I don't know. There's no macros for this. I know it's off. Like I put it in. But it's basically saying there's like no fat in bone broth. I'm like, yeah, not my bone broth. It's all full of fat. So I know the macros are off, whatever. Right. I can't track perfectly, right? If I make something like that, I have no idea. It's healthy for me. I'm not worried about it. But yeah, Gail, I know you do square dancing. I literally can't do much exercise. I walk some and square dance. Yes, that's good though. I'm not allowed to push myself. I get that. Karen, I had a double day yoga, then lifting. Awesome. Yeah, I might need to do some yoga in the classroom with the students because it was 34 degrees this morning during our PE time. And like, we're not allowed to take the kids out when it's that cold here. I know, bunch of sissies over here in Southern California, but yeah, they won't let us. They're like, nope, it's inclement weather. Stay inside.
It's cold here for sure. Yeah. Otherwise, I would go for a walk outside, but it's
Susan, I ate a whole pack of uncured bacon plus burger patties. I had 3. So yeah, so that was my lunch, the 2 hard-boiled eggs, the can of salmon, and it's like a cup and a half of my bone broth, which is very fatty. Like, I don't know what the macros are on it though. And then for dinner, I had 3 quarter-pound burger patties. It was bacon ends and pieces. So I don't know how many, it wasn't a whole pack. I don't know how much it was. Maybe the equivalent of 4 slices of bacon. And a tablespoon of butter. And I'm like, I was like struggling to get that last burger patty down. Struggling. Like I'm stuffed. And then I had like a half a scoop of the Prime Equip protein just to get, because my protein wasn't quite high enough. That stuff is like high protein and hardly any fat. My fat was plenty high. My protein wasn't high enough. So I had a cup of coffee with a half a scoop of that prime protein powder in there, just because it's beef isolate protein is what it is.
Yeah, I have the vanilla one.
Yeah. So just to up my protein. Okay. Last question then. And then we have been on for an hour and a half, but you said you had the vanilla. Have you made that pancakes, the protein pancakes with the vanilla that I've seen all over the internet?
Yeah, I think I did a short on it. Yeah.
Okay. Are they good? Like, would my kids eat them?
Okay. So how picky are your kids? Because I have one that will and one that won't.
Okay. So it's just try it.
I've heard people say that they don't have an eggy taste, but they do. Or maybe I'm just sensitive to that, although I love eggs, and they have a texture. So my one boy has a texture issue. So the texture is different. They're very rubbery because the one that I make has the gelatin in it, the beef unflavored gelatin, the protein powder, and the eggs.
Okay.
But I think even
baking powder in, because some of them put a little baking powder in there, and I'm wondering if that'll make them. I mean, I know it'll make them a little more fluffy. Maybe that would fix that rubbery issue that you're talking about.
I'm trying to remember if the ones, I don't think I did in mine. I don't think so. I've done a couple different ones, but I have made several with the vanilla equip. And I mean, I like them. I ate them. Okay. And then I like to make a bunch of them. They don't cook up like regular pancakes though. Right. So be aware of that. I make a bunch of them and then I put them in the refrigerator in the Ziploc bag and I eat them cold. So even if you were to eat a cold pancake, it would have a different texture to it. So maybe I'm just weird that way, but it doesn't bother me.
Have you ever frozen them and then done them that, because I was thinking if my kids like them, I could freeze them and then they could have those available like on school mornings to like warm up like in the toaster oven or something and eat.
I haven't frozen them. They don't last long enough for me to do that.
I just wondering if you tried that experiment. So yeah, first thing I have to do is buy some of the vanilla because all I have is the chocolate.
I don't know why they wouldn't freeze well though. I mean,
yeah. All right. Well, I just have to give it a shot. Nobody's saying in the chat that they did. So yeah, Gail is saying that meal would have been about $20. The meal with the bacon and the burger patties. Yeah, I know. It's crazy. Walmart had the burger patties. They were like $2 off the like frozen, like the 80-20 burger patties. I was so excited. I bought a couple of them. I was like, sweet.
Yeah, I get the big tubes of them from Sam's Club, the sirloin ones.
Yeah.
I don't be careful with them though, because some of them have weird ingredients in them. But
yeah, mine are just, they're like the Great Value ones from Walmart. They're just, I don't have a Sam's membership. So yeah, there's that. Oh, Lindy popped in. Hi, Lindy. She just got home. How are you all? Doing great, Lindy. How are you? Nice to see you in. And then Gail saying protein pancakes might be a good way to get extra collagen. Yeah, I'm going to give it a try. I'm hoping for my kids because right now, so we've kind of gotten them eating a lot more meat at dinner, which was a struggle. Now I got to get them off the oatmeal in the morning. So I'm like, what could I do?
Oatmeal was a big thing for me, man. I loved oatmeal. Oh.
Yeah. So
I had oatmeal every day.
You know, like I said, I just started this way of eating in February. I didn't know any better. I'm not beating myself up, but they're 18 and 15. We worked on the meat. They're eating a lot more meat.
Oh, I have say nothing. My kids I'm the only person in the house that eats this way. And I have the one boy, he will eat just about anything, but he has braces. So he has a hard time eating a lot of stuff. Mm-hmm. The other boy, I'm telling you, and I know we all joke about this, but I think this might be the pickiest kid on the planet. And I know I'll get a lot of crap about it, about you're the parent, you should control. But you know what? If you've ever had a battle with a child that will not, and they've puked on your table or whatever, then you can come and talk to me about it. But he eats SpaghettiOs ABCs and 1, 2, 3s, chicken nuggets or chicken fingers. He'll eat waffles. He'll eat pancakes. He'll eat Cinnamon Toast Crunch, which for the record is one of the worst cereals that kids can eat. But he has like a very limited window of things that he will eat. And we have tried. It is not for lack of, we've sat at the dinner table for hours of screaming, crying. You force him to eat, he throws up. No, it's not worth it at this point. I just keep offering stuff to him. He does try it.
Yep.
And if one day, if he's going to eat it, he's going to eat it. But if he's not, he's not, because I mean, I might be a bad parent, but I'm not forcing them to eat any particular way because, well,
No, I can. We're so not only are we bladder buddies, people were saying that up in the chat earlier, bladder buddies. Not only are we bladder buddies, Kat, but my son also has sensory integration processing disorder, and part of that is in his mouth with texture.
Texture, yep, that's.
And I have been there with the throwing up on the kitchen table. I understand you. That is not an exaggeration, you guys. She is not exaggerating. My child has thrown up all over the kitchen table because a texture got in his mouth that he did not like.
And that is exactly what Aiden has. Epilepsy. He's also got a lot of other things, but he has the same sensory issues and textures and even clothes. It ain't just his mouth. It's clothes touching him, things like that. It's a lot of different things. And if you've ever dealt with a child like that.
Yep. If I buy him different clothes, he's very sensitive to that. So it's like, why did these pants feel whatever? Well, they're just
different. You say that because we can't get him to wear jeans. He has this one pair of sweatpants. I kid you not. I have to force away from him to wash because that's the only pair of long-legged pants. And I often wonder if he is maybe not slightly autistic like his older brother, much of a different end of the spectrum, but
yeah. So my son is not autistic, but he did in elementary school. He's better now. I mean, a lot better now, but he used to be very sensitive to noise. So he would have the noise canceling headphones. Like that was one of his like interventions.
It is the same way.
Yep. He couldn't, like, it was just overwhelming to him if there were 30 kids in the classroom with all of the noise that went along with that.
But I will admit that I have a little bit of that myself because, and I know people joke about it, but if you smack or make noises when you're eating, it will actually make me throw up. Like one of our boys is a very noisy eater and I can't eat at the table with him because it actually makes me sick to my stomach, but it does that to him as well. So he has the same, must be the same exact thing.
Yeah, my son just heard me say that. He like was going into the kitchen and he heard me say that. And he said, I'm still sensitive to noise. I've just learned to tune it out. So that's what I mean by better. It's like he's got some like it's still there, but he's got coping strategies. So like when he was little, he would wear the headphones. Now he's got coping strategies that he can deal with it, but it still bothers him. Yeah.
Yep. Same.
So I mean,
I would love to get Aiden on a carnivore diet. And I thought that I could just, with bacon. I mean, who doesn't like bacon, right? He doesn't like bacon. And it's so funny to see it because he'll put it like a little bit in his mouth and you just see him. He's like, and I'm just like, and then he's like, no, I don't like it. And he was like, it's like chewy or whatever, and I'm like, but it's bacon, it's the candy of meats. But I would love to get him on the carnivore diet because of all of his issues, but I don't know that that's going to be a possible thing for him.
I mean, when we went to my brother's house for Christmas and my boy with these issues was eating the beef roast, you don't even know the like little sugar inside of me that was like, oh, I can't believe he's eating this and liking it. And then the next day he goes, that day we were there, he said, can we bring home leftovers? And my brother said we could. And so then he asked me, like, can you teach me how to reheat these leftovers? And so, yeah, it was like he had the leftovers too. I mean, he legitimately liked it. But when I tried to get him to eat ground beef, so my other son is starting to like ground beef. And I was like, let's just try it in a bowl with like some cheese. Nope, I already told you I don't like it. It's the texture. I can't do it. I'm like, okay, just have something else, But yeah, you would think it would be the other way around. But yeah, the ground beef texture, he doesn't like that. He hasn't gotten past it.
It's the same thing with rice. It's just a bunch of like grainy stuff in one thing. It's like, if it's just like a big hunk of meat, I can deal with that. But if it's a bunch of little pieces, I can't.
Okay, do you hear that from his mouth, from his very own mouth? So he cannot deal with a bunch of little pieces. Yeah, he doesn't like it.
So. I mean, it is what it is.
Mm-hmm. And Lynn, your live stream must have gotten over. Hi, nice to see you. Our live stream's just about to wrap up too. Yeah, so I mean, I don't want to like kick anybody off, Kat, but we have been here for an hour and 40 minutes.
No, it's fine. I
So,
got kids to feed anyways.
yeah, I was just going to ask. I want to be respectful of your time. I don't want to take your whole evening. Robin is saying hi, Christy's son. His name is Zach. So that was Zach doing the talking. You can see he's not shy. So there's that. Oh my goodness. Cooked up a small pork roast tonight, low and slow, with apple cider vinegar, I think would be ACV, Tony's, and Redmond's smoked salt. I love Redmond's smoked salt.
Did you get the new one? The new apple pecan one, I think it is. The brand new one that they just had out over the holidays. That one is
yeah. I haven't tried that one. But people were saying after we did the meatloaf relay, Robin was involved in the meatloaf relay with me. And anyways, people were saying instead of just putting regular salt in the meatloaf, put the smoked salt in the meatloaf. Like I can envision that when I do that. I haven't done it yet, but like that's going to be so delicious. I'm very excited about that. Thanks, David. You're awesome. So Lynn, can you give us a sneak peek? How many seconds are you up to? Will you give us a sneak peek? Lynn is doing a plank challenge and I've been watching her. And every time she's been doing this plank, she's been improving her time. Maybe she'll give us a sneak peek of how many seconds she's up to. She's killing it on planks, you guys. Lynn, let me know if you get a callus on your elbow, because by the end of, I think it was November when I was doing my planks, I had like a little callus on each elbow. Here we go. Look at this, you guys. 28 seconds, and she started at 8 seconds.
wow.
What? Awesome.
That is awesome. I don't think I could hold myself up at all. If I got down on the floor, I probably wouldn't be able to get back up.
Robin is saying she did the smoked salt in her meatloaf. Was it good? Robin, I've heard it's delicious. Like more than one person has told me that. Lynn is like, LOL, no calluses yet. Yet, Lynn, yet is the key word. No, seriously, I hope you don't get them. I see you have carpet. I was on like a yoga mat. I don't know if that makes a difference. The surface, that you're on. And go, Lynn. All right. Well, Kat has kids to feed, you guys, and I probably got to do some teacher stuff. Just kidding. I don't do teacher stuff at home. My report cards are done. They're till Friday. They are done, people.
Awesome.
But I have a new channel member. I got to go see what I'm going to go do for her. I got to remind myself what
Yeah, that's right.
there and make sure she gets her due. So thank you again so much for joining my channel, Gail. I appreciate that. And you guys all have a great night, and we'll see you on the next one. Hopefully we'll catch you for Lioness tomorrow, you guys. Anita, ketogenic woman. So it's going to be a good one. Awesome. All right. We'll see you around. Bye, everybody.
Bye.